This video should be seen as a preliminary to open policy debate about the bill. People often ask me, why do I support the bill? Simply put, because it will save lives and it'll prevent human suffering. I mean, that's fundamentally the only reason to support the bill as it is. I mean, there are problems with the bill. Nobody's saying the bill is perfect. I have many problems myself with the bill, but the fact of the matter is that it represents a huge step forward toward a more humane system of healthcare. The most frequent argument against it that I hear, other than the repetition of obvious fear-mongering lies like that it will establish death panels, to kill grandma or whatever, is that it is simply unsound economic policy. To anyone espousing this view, I would ask the following questions. Is it sound policy to reduce the deficit? Because the Congressional Budget Office has estimated that it will reduce the deficit over the next 10 years by $138 billion. Second question, if such measures are so economically unsound, why have none of the other industrial or post-industrial nations with similar coverage seen it wreck their economic systems? Also, why is it that we pay more per capita than any of these nations? Third question, and I think that this is the most important question, is that why would you believe that the economic soundness of a policy is more important than the policy's impact on human rights? Certainly there are instances in which economic unsoundness could collapse an entire system and cause much more human suffering and that sort of thing, but surely you do not think this about the current bill. I eagerly await your responses.